Hello, my name is Heather Law. I'm an orthopedic and pelvic floor physical therapist and mom of soon to be 3. I'm currently 34 weeks pregnant with my third. He is measuring in the 80th percentile right now, so we are rapidly growing at this point. I wanted to make a video of a couple of different abdominal massage techniques that have been helpful for myself and a lot of my clients. Reasons why we do abdominal massage are to help keep the skin nice and healthy and hydrated through pregnancy. It's also helpful if we feel a lot of that itchiness, especially during the winter months when it's really cold and dry. It can be preventative for stretch marks. So again, just keeping up that nice elasticity and hydration of the skin. It can be helpful to relieve some of the round ligament pain, rib pain, back pain, any of the discomfort as the baby starts to rapidly go through different growth spurts and feel like they're gonna burst out of you. And it can be helpful to minimize risk of DRA by taking off pressure in the front of the abdomen and releasing through the sides and the back body. So for me, I've been using the Primally Pure products. So I use the body butter and the baby oil. That's what works great for me and my skin. There are tons of great products out there. Just make sure to read the ingredients. If you're not sure what you're reading, you can use the Yucca app and you can scan the barcode and it'll tell you ingredients good or bad and give it a rating. So that's a nice, easy way to see kind of what you're using and if it's right for you and your skin. So we want to do the abdominal massage, trying to get 1 to 2 times a day, every day. So that being said, I am a mom of 3 and that doesn't always happen for me. So through most of the pregnancy, I tried to get at least 3 to 4 times a week, a little more consistent at night. Now that we're in this final stage here, I do a better job of at least doing once a day. If I can make twice a day, great. If not, this is where we are. So usually I start with the lotion. You could do the lotion first, the oil first, it doesn't matter. Lotion first is what's been working for me. So you can just roll it all over your skin if that's all you have time for, kind of focusing on any areas that give you any trouble. If you want to try to be a little more localized, we can do some skin rolling. So that's where we just kind of pinch the skin and we should be able to just roll nice and easily along the side of your body. And then you can go a little further back. Any spots that feel like they're harder to pinch and grab is an indication that that's a spot we want to spend a little more time on. There's a little more tightness in the tissue. So for me, on my right side, it's tighter. So already right away, I can't grab it as easily as I could on the left. And so I grab on, kind of do that skin rolling, noting, okay, it's especially when I get to the back, really hard for me to kind of pick up and grab. So that's where I would spend some time doing some extra massage on. We can also kind of focus along certain areas where you're having discomfort. So I'm getting a lot more pressure under my abdomen. So I can find that pubic symphysis, the front of the pelvis, kind of where you can get that lightning crotch pain, and do just some gentle lifts of my belly. I can also kind of focus more round ligament pain on the side and hip flexors and find the front of my pelvis, go into a hip flexor stretch, and then gently move my arms up. If we want to just hold there with a lift and kind of go in and out of that hip flexor stretch, we can do that. Or I can add a gentle reach. So same thing on the other side. Hip flexor stretch, just kind of hold in and out. Or I can add that reach or just do massage. Another big spot is along the diaphragm under the rib cage. So just kind of finding right where the ribs end. And so for me, there's not a lot of space, so I'm not gonna get very far, but you can reach under there. This is kind of nice if you're getting a lot of acid reflux to just be gentle right here, but try to release some of the tension around this area. And then if we want to also add a little bit of bowel massage for motility, we can add in kind of a brief little I love you massage. So through pregnancy, a lot of people are prone to constipation and slowing of our bowel movements. So with the I love you massage, just kind of abbreviated version, we always want to go from right to left. So if we kind of start the right hip, go and working our way up and across under the rib cage, down and through to the sigmoid colon and rectum here. So you could do a couple bouts of that. If you want to do the true I love you massage, I have another video for that, so just send me a message and I'll send that to you. Another tool I like to use, so if we switch over to the oil, are my cups. So this is just a little suction cup. I like to use this along the side. So remember how this side was a little tighter for me, and along my back. So you can either use the oil on your skin or you can even put a little lotion on the rim here. So we're just gonna suction on. If I let go, it stays. And I usually like to kind of slide it along the side, so I can slide it as I'm doing a reach. Or if I want to focus more along the back, I can slide it. It's falling off a little. Slide it as I bend forward. Or I can even set it on my back. Say I'm having a lot of pressure along my low back. Set it on there. I like to use these in the shower, so I'll put it on there, wash my hair, and then take it off when I'm done. If you feel like I can't reach back there, that's really hard, just ask a partner for help. These are really nice and easy and cheap to get on Amazon, easy to use. Be careful over the front of the belly. I more so use it away from the baby, kind of along the sides or the low back to release some tension there. So those are all the big abdominal massage techniques that I like to utilize. Let me know if you have any questions or concerns. None of this should be painful. If you feel like you're confused or having a hard time doing it yourself, just send me a message and let me know, and I'd be happy to help.